come in.
Hello, how are you today?
I'm good, thank you.
Oh, terrific. My name's Sean. I'm your CNA, your nursing assistant. Do you mind if I check your ID bracelet?
No, not at all.
Oh, hi, Miss Pat.
Hello.
Miss Pat, I've come in to assist you with cleaning your catheter. Would that be okay?
That'd be fine, thank you.
All right, great. Well, you have your call bell. Let me step over and wash my hands. I'll be right back.
Okay, thanks a lot.
All right, at this time, I would go and wash my hands using proper technique, and when I return, I'd go ahead and don my gloves. And as I'm donning my gloves, I'm thinking about the resident's privacy. Miss Pat, do you mind if I close your door and curtain?
No, I don't mind.
Now, always remember on this process, we're going to expose the resident, so we want to close the curtain just as an added measure to make sure that if somebody forgets to use their manners, they'll run into a curtain and that'll remind them. And now I'm going to gather my supplies. Miss Pat, do you mind if I go on your bedside table?
No, not at all.
Okay, well thank you. Always very good to consider that this is pretty much where the resident lives and a lot of their personal belongings are there, so it's very good to ask if we can go into their personal belongings. You want a minimum of 6 wash rags. If you have a few more, there's no problem there. And we're going to go ahead and grab one towel and an incontinence pad. Now while I have my incontinence pad out here, I'm going to go ahead and roll it and get it ready to go into the resident. Now what's important to note is that it's a rectangle. The long portion goes across the body and the shorter portion is from head to toe. So I'm going to go ahead and roll it up as nicely as I can. It is a little awkward, but you see I'm not allowing it to touch anything and really get it soiled. And that's probably as far as I need to go, so I'll just fold it up and set it right here. I've already asked permission to go on the bedside table, so I'm going to grab a basin and I'm going to grab some soap. Alright guys, so what I've done here, I've used this as a divider. This is going to be where my dirty linen goes, and I can scoot this over as I progress through the procedure. Alright, Miss Pat, you have your call bell. I'm going to go get some water in this basin. Would that be okay with you?
That'd be fine.
Alright, I'll be right back.
Okay.
So I'm going to go over to the sink and fill this up with nice warm water. And I'm going to come back and get Miss Pat to test this for me. Miss Pat, would you test this water?
Oh yeah, that feels good.
Okay, great. Alright, Miss Pat, may I lower the head of your bed?
Yes.
Okay, great. Now we're going to be rolling her in this procedure, so for her comfort, we're always going to lay them in supine position if we're going to turn them. We're never going to turn them while they're sitting up. Are you doing okay, Miss Pat?
I am, thank you.
Okay, you're welcome. Let's place the call bell right here. We don't want to forget that when we're done. Alright, Miss Pat, I'm going to place an incontinence pad under you, okay?
That'd be fine.
So I'm just going to move some of these linens.
Okay.
Now, we want to be careful to expose her minimally, but there's no avoiding it totally. Alright, Miss Pat, I'm going to assist you to turn at a count of 3. Would that be okay?
That'd be fine.
Alright, 1, 2, and 3. You can always bend their legs a little, adjust the pillow, make sure they're not too close to the edge of the bed so they're nice, safe distance so they won't fall. And now we can unroll this. Make sure there's no creases in the linen. Alright, Miss Pat, on the count of 3 we're going to turn back. 1, 2, 3. Okay. Now the nurse aid evaluator does act as the mannequin's voice throughout this procedure and also moves with the mannequin. Miss Pat, I'm going to adjust your pillow, okay?
Okay.
Alright. Now, once you get the incontinence pad underneath, if you are tall and you roll it out right, all you have to do is have the resident lean slightly and you can just unroll it the rest of the way and you're all done. So it's pretty nice. If you're not really tall or you feel the need, you can definitely go around to the other side and finish that. Alright, Miss Pat, I'm going to place this towel over you to keep you warm and so we don't expose you so much, okay?
Okay.
How are you doing?
I'm good, thanks.
Now, I know she has a gown on, so I have a little leeway. I'm going to fan fold this sheet and blanket down to Miss Pat's knees. I'm going to have to pull this back up later, so I want to use good technique. The catheter is nice and secure. It's coiled, so the nursing assistant who came before me was well trained and did a good job. All right, Miss Pat. You doing okay?
Yes, yes, thank
All right, I'm going to go ahead and expose you for just a minute, and we'll get everything nice and clean, okay?
you. Okay.
All right. How are you doing?
I'm good, good.
Okay. So I'm going to go ahead. Actually, I'm going to go around the other side. Maybe you'll be able to see a little bit clearer when I do my cleaning of the catheter and the labia. This side's still clean, so I'm going to switch my clean and dirty side. I think this might give you a better opportunity to visualize what I'm doing. I'm going to go ahead and make a mitten. Again, no hard seams, all nice and folded. Wet my washcloth, and I'm going to apply a little bit of soap. Now again, you're not going to apply soap directly to your basin water because that's also a rinsing soap, okay? I'm going to use my left hand to expose the labia, okay? Using this technique, I'm going to use a finger for the middle, a finger for the right labia, and a separate finger for the left. So we'll do the middle first. We're going to go from clean to dirtiest, or top to bottom. So I'm going to go down right down the center, and I'm going to question mark around the catheter. And I'm going to use another finger for the right labia and a second finger for the left labia. I'm done with this rag, so I'm going to place it on my dirty side. And this is my rinsing rag. We're going to rinse and dry using the exact same technique, okay? Miss Pat, you doing okay?
Yes, 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 thank you.
Okay. Don't forget that indirect care is one of the things you're graded on. So again, we're going to question mark around the catheter, clean the right labia and the left labia, all with separate fingers. From top to bottom, or clean to dirty. And we're going to dry using the exact same technique. You are timed, you only have 15 minutes, so keep that in mind. Okay, we're going to expose the area. We're going to question mark around the center from clean to dirty, right labia, left labia, all with separate fingers. Now all we have to do is clean the catheter, and we are all done. And it's very much the same technique that you've already used, so let's get our rag, our mitten done. I'm trying to step back so you can see, but I'm sprinkling a little bit of water on the floor. So just be aware of that and be careful when you're practicing. You don't want to slip and fall on anything. Okay, again, I'm going to apply soap directly to the rag. We're going to soap it up. Now what I'm going to do is I'm going to secure this catheter, and I'm going to clean all four sides with 4 separate fingers. So I'm going to clean the bottom first. We're going to clean 3 to 4 inches down. We're going to clean from the meatus, or the body, out 3 to 4 inches. Okay, that was the bottom. Now I'm going to do the right, the top, and the left side of the catheter. That's washing. And you see how I secured that catheter on the leg. So we do not want to dislodge that catheter. And we don't want to do anything to drag bacteria where the catheter enters the body, because these patients and residents can get urinary tract infections. All right, guys, we're almost home, so hang in there. Miss Pat, how are you doing?
I'm good, I'm good.
Okay. Again, I'm going to secure it. Now I'll be a little faster this time. Bottom, 3 to 4 inches. Side, top, and other side. And that is while I'm securing the catheter. And now let's dry Miss Pat. Now one of the things that is really, really easy to mess up on in this procedure is the incontinence pad. So you guys watch me close and make sure I don't do that, okay? I don't forget it. Okay, bottom, right, top, left, all with separate fingers. And I do have an extra rag, so I'm just going to dry Miss Pat up where I was securing her. Okay, there's nothing wrong with doing that. All right, Miss Pat, I'm going to get you covered up, okay?
Okay.
Now it's very important that you leave the catheter unkinked and coiled as it is, and it's hanging on a solid part of the bed frame. I don't know if you can see that, but this is the very much the important part, okay? And now that her gown's covering up, I can take this off. Again, we do not want to forget to get this incontinence pad, but I'm going to cover Miss Pat so she is exposed minimally Now I'm going to go to the other side and we're going to remove it the same way that we placed it. Neatness counts because you feel better when you're in a neat bed. Miss Pat, are you doing okay?
Yes, yes, thanks.
All right, terrific. All right, Miss Pat, I'm just going to fold this up again where we don't expose you much. Okay, on the count of 3, I'm going to assist you to roll one more time, okay?
Okay.
Ready? 1, 2, 3. Remember to adjust the pillow under her head. She's a safe distance from the edge. I'm going to roll this up much in the same way I placed it. Tuck it under a little bit. Okay, Miss Pat, 1, 2, 3. Back on your back. Okay. All right. Adjust her pillow. Thank you, Miss Pat. All right, guys. Now, I'm just going to assist Miss Pat to lift up a little bit, and I can pull this out without creating friction or shear. I'm going to check Miss Pat's catheter one more time, guys. Make sure it's not kinked, it's coiled, it's really good. The same way the nursing assistant left it before me, I want to leave it. Now we're always going to take care of the resident first, so I'm going to place the call bell back in Miss Pat's hand. Her pillow looks good. Miss Pat, may I raise the head of your bed?
Sure, sure.
Okay. Also, I'm going to take this opportunity to lower the bed to its fully lowest position. That's a real matter of safety. The resident could try to get up while you're gone and fall, break a hip, and really cause himself some issues. Miss Pat, is that comfortable?
That's good, thank you.
Okay, the bed is in its lowest position. Can I get you anything else, Miss Pat, before I go?
I feel great. Thank you very much.
Okay, amazing. So I'm going to step out and wash this basin. Your call bell's in your hand if you need me.
Okay, okay, sure.
All right. Okay, so now I'm going to go to the sink and I'm going to dump all the contents in this basin into the bedside commode or toilet. And I'm going to rinse from the outside in, or cleanest to dirtiest. I want to dry from the cleanest to dirtiest. Then I'm going to bring a barrier back with me and use it to open the drawers to her bedside table. So let me go do that now. Okay, now we're going to demonstrate how to take care of a wash basin when you're done with its use. Okay, the first thing I'm going to do, none of the contents of the wash basin ever go into the sink. So I'm going to use a barrier and raise the toilet seat of this bedside commode. Now that I've touched that bedside commode with it, I'm not going to use it as a barrier for anything. I'm going to carefully dump my water in there. Okay, I'm going to get this barrier and turn on my water. Now, it's very difficult to rinse this big basin in this little sink without touching it, so I'm going to use a napkin to help rinse it. Again, we're going to rinse from outside in, our cleanest point to dirtiest point, okay? So let's do that now. I'm going to really saturate my rag. Do your best not to touch the sink, but it's really difficult. Okay, I'm not going to make a career out of being down there. Alright, I'm just going to use this to swish some water around. Again, I'm going to dump it into the bedside commode, not the sink. I'm done with the water, so I'll turn that off. And let me go ahead and dry this. Again, I'm going to dry from the outside in, or cleanest point to dirtiest point. In the medical field, it's a good practice to always do things from the cleanest to the dirtiest. If you're going to touch something clean, do it first, okay? You don't want to drag anything dirty onto something clean, okay? I'm going to finish cleaning this inside point, this innermost point. I'm pretty happy with that. I want to make sure that I close this toilet lid, and now that I've touched this toilet lid, I'm not going to use this barrier any longer. Now I'm going to take a barrier back to open the door of the bedside dresser or table and place this bedpan back where I got it, or this wash basin back where I got it. Alright, let's do that now. Miss Pat, may I go back in your bedside table one more time?
Sure, sure.
Okay. Miss Pat. May I open your door? Do you mind?
Yes, yeah.
Okay. So we're going to open our door and curtain. Now, we at ACT again feel strongly that you do a post-procedure check. So before I go on, I'm going to stop and look around. The bed's in its lowest position. I've already raised Miss Pat. She's very comfortable. She has her call bell. Everything is back where I have it. Everything is clean and tidy. So at this time, I'm going to deglove and wash my hands. Miss Pat, I'm going to wash my hands. If you need me, you call me, okay?
I will.
Okay. Using proper technique, I'm going to deglove. Announce to the evaluator that I'm going to wash my hands using proper technique, and end of skill.